Let's take a look at what is high blood pressure. High blood pressure, also known as hypertension, is a condition where the pressure of blood against the walls of the arteries is consistently elevated. This can lead to serious health problems such as heart disease, stroke, and kidney disease. Blood pressure is the force of blood against the walls of the arteries as the heart pumps it around. High blood pressure, also known as hypertension, is a condition in which this pressure is consistently higher than normal. Blood pressure is measured using two numbers: systolic pressure, which is the pressure when the heart beats, and diastolic pressure, which is the pressure when the heart is at rest between beats. A blood pressure reading of 120/80ths of a millimeter Hg or lower is considered normal, while a reading of 130/80ths of a millimeter Hg or higher is considered high. In today's video we would take a look at what high blood pressure is, ways to manage it, signs and symptoms, myths and misconception about high blood pressure. There are typically no signs or symptoms of high blood pressure, which is why it is often referred to as the silent killer. However, in severe cases, some people may experience headaches, dizziness, blurred vision, and shortness of breath. There are several factors that can increase your risk of developing high blood pressure, including age. The risk of high blood pressure increases as you get older. Family history. If your parents or other close relatives have high blood pressure, you may be more likely to develop it. Being overweight or obese. Carrying excess weight puts extra strain on the heart and can lead to high blood pressure. Lack of physical activity. Regular physical activity helps keep the heart healthy and can lower the risk of high blood pressure. Smoking. Smoking damages the blood vessels and can increase blood pressure. Stress. While stress alone does not cause high blood pressure, it can contribute to other risk factors such as overeating or smoking. There are several myths about high blood pressure that should be dispelled. One myth is that high blood pressure only affects older people, but in reality, people of any age can develop it. Another myth is that people with high blood pressure always experience symptoms, but as mentioned earlier, this is not always the case. Thirdly, some people believe that high blood pressure is caused by stress alone, but this is only one of many contributing factors. Another myth is that blood pressure is not a big issue. It is a condition that can be prevented and if left unattended can lead to heart attack, stroke, kidney failure, vision loss, peripheral artery disease. None of these conditions mentioned can be taken lightly, and can even cause death. Fifth myth is that hypertension only runs in the family. This statement is partly true. Studies have shown that hypertension is hereditary and can be passed down, but this can be avoided. If you believe this statement and justify how you live simply believing that you will have hypertension anyway because your family has it, then you will be very wrong because it can be totally avoided with good lifestyle choices. Myth number 6 is that so long as I do not take table salt I won't have hypertension. Sodium intake is just one of the popular things to avoid when managing blood pressure. There is sodium in ultra-processed foods such as bread, pizzas, burritos, tacos, just to mention a few. So while reducing table salt is good, it will not be effective unless you take care of other parts of your diet. Fortunately, there are several ways to lower blood pressure. 1. Weight loss. Watch your waistline and drop the additional weight. Weight gain frequently causes an increase in blood pressure. In addition to raising blood pressure, being overweight can lead to sleep apnea, which disrupts breathing while you're asleep. One of the best way of life adjustments for lowering blood pressure is weight loss. Even a minor weight loss can help lower blood pressure if you are obese or overweight. In general, each kilogram (2.2 pounds) of weight dropped may result in a reduction in blood pressure of roughly 1 millimeter of mercury (mHg). The size of the waistline is also crucial. High blood pressure risk can be increased by carrying too much weight around the waist. All in all, males who have a waist measurement of more than 40 inches are at risk. 2. Exercise. Regular exercise. Physical activity on a regular basis can reduce high blood pressure by 5 to 8 millimeters Hg. To prevent blood pressure from increasing once more, it's crucial to continue exercising. Aim for at least 30 minutes of moderate physical activity each day as a general objective. Exercise can also prevent high blood pressure from developing in those with raised blood pressure, hypertension. Regular exercise can help people with hypertension lower their blood pressure to a safe level. Walking, jogging, cycling, swimming, or dancing are some forms of aerobic exercise that can lower blood pressure. High-intensity interval training is another option. Short bursts of intense exercise are interspersed with slower intervals of activity during this form of training. Moreover, strength exercise helps lower blood pressure. 3. Eat healthy. Eat a balanced diet. A diet low in saturated fat and cholesterol and high in whole grains, Fruits, vegetables, low-fat dairy products can reduce high blood pressure by up to 11 mm Hg. The Mediterranean diet and the dietary approaches to stop hypertension diet are two examples of eating regimens that can lower blood pressure. Salts, sodium's effects on blood pressure can be lessened by potassium in the diet. Foods like fruits and vegetables are better providers of potassium than supplements. Aim for 3,500 to 5,000 mg per day, which may result in a 4–5 mm Hg reduction in blood pressure. Find out how much potassium you need by speaking with your doctor. 4. Reduce sodium in your diet. Eat a diet low in sodium, salt. Even a little decrease in sodium intake can help the heart and lower blood pressure by 5 to 6 mm Hg. Several groups of people respond differently to sodium consumption in terms of blood pressure. Generally speaking, keep your daily sodium intake to 2,300 mg or fewer. For most adults, though, a daily salt consumption of 1,500 mg or less is ideal. To cut back on salt intake, read the food labels. Search for foods and beverages that are low in sodium. Reduce your intake of processed foods. Only a limited quantity of salt is present in food naturally. Sodium is primarily added during processing. Avoid adding salt. Employ spices or herbs to give food flavor. 5. Restrict your alcohol consumption. It is possible to reduce blood pressure by roughly 4 mm Hg by limiting alcohol consumption to fewer than 1 drink per day for women and 2 drinks per day for males. 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of an 80-proof liquor constitute 1 drink. Nonetheless, consuming too much alcohol can cause a significant increase in blood pressure. Moreover, it may lessen the impact of blood pressure drugs. 6. Give up smoking. Blood pressure goes up when you smoke. Smoking cessation lowers blood pressure. Also, it can enhance general health and lower the risk of developing heart disease, thereby extending lifespan. 7. Have a restful night's sleep. Getting less than 6 hours of sleep each night for a few weeks might result in poor sleep quality, which can lead to hypertension. Many conditions, such as sleep apnea, restless legs syndrome, and general insomnia, can interfere with sleep insomnia. If you frequently have difficulties sleeping, let your healthcare professional know. 8. Reduce tension. Chronic long-term emotional stress may be a factor in high blood pressure. To determine whether stress management practices help lower blood pressure, more study on their effects is required. Check your blood pressure at home, and visit the doctor frequently. You can keep an eye on your blood pressure at home. It can ensure that your lifestyle adjustments and drugs are effective. It's not necessary to get a prescription to purchase a home blood pressure monitor. Before you begin, discuss home monitoring with a healthcare practitioner. Controlling blood pressure also requires routine doctor visits. Ask your doctor how frequently you should have your blood pressure checked if it is under control. You might only be allowed to check it once or twice every day. What are the complications of high blood pressure? If left untreated, high blood pressure can lead to several serious health problems, including heart disease. High blood pressure can damage the arteries that supply blood to the heart, leading to heart disease or heart attack. Stroke. High blood pressure can increase the risk of stroke by damaging the blood vessels in the brain. Kidney disease. High blood pressure can damage the blood vessels in the kidneys, leading to kidney disease or kidney failure. Vision loss. High blood pressure can damage the blood vessels in the eyes, leading to vision loss or blindness.